Hello doctors, today we are going to study about the topic anatomy and physiology of female genital tract and its organs. So understanding this is the foundation for diagnosing and managing the gynecological and obstetric disorders. So it's very important to know the anatomy and physiology of not only the female reproductive part, even all the parts and organs of the body. So let's move forward to the topic. So, in this session, we are going to understand the female genital anatomy and its essential in obstetrics and gynecology, and as well as the physiology, which explains the normal functions of this reproductive system, and and also the knowledge which helps in diagnosing the managing gynecological and obstetric disorders. So without a strong grasp of normal anatomy and physiology, we cannot properly understand conditions like infertility, abnormal bleeding, or any pelvic infections. So today we'll cover each organ, and then we'll link it with the physiology. Okay, so the first is external genitalia, that is the vulva. So these are the external genitalia. It is, or the vulva is the external protective structure. So as you can see in the picture, it is a like it have three parts like mons pubis, labia majora, and labia minora. And there is a clitoris, which is for erectile tissue, and is important in sexual arousal. And the vestibule, it has the urethral opening and the vaginal opening, and Bartholin's glands are present in the vestibule. And in perineum is the area between the vagina and the anus. So as you can see in the diagram below. So these are the external protective structures. Clinically, it is important in trauma, infections, and congenital anomalies. So, and Bartholin's gland cyst and the abscess are the common in OPD cases. So, Bartholin's gland cyst and abscess are the most cases we see in the OPD basis. So, this is the external genitalia part, or the vulva. Moving on to the vagina. So the vagina plays a role, very important role in the childbirth and also defense. So it is acidic in nature, and clinically we'll see a few disorders like vaginitis, infections, and trauma. These are the common presentations which we'll see in clinical OPD basis. And talking about the vagina, it is a fibromuscular canal extending from the vulva to uterus, and the main functions are menstrual flow, intercourse, and the childbirth passage. And it is lined by a stratified squamous epithelium, and as I've mentioned, it is acidic, and the pH is maintained acidic by the lactobacilli. So this is what the vagina part means. Moving on to the uterus. So uterus, it is the most important part in the gynecological and both obstetric also. The uterus is the central to reproduction, and there are many cases clinically. We'll see fibroids, adenomyosis, and cancers are common pathologies which happens in the uterus. And talking about the anatomy, it is a hollow muscular organ, pear shaped, as you can see in the picture below. And there are three parts: fundus, body, and cervix. And there are three layers: endometrium, myometrium, perimetrium. And about the blood supply, it is through the uterine and ovarian arteries. So this is the basic all the important points of anatomy of uterus. So uterus anatomy, it is a hollow muscular organ, pear shaped. There are three parts: fundus, body, and cervix. And there are three layers: endometrium, myometrium, perimetrium. And the blood supply is through the uterine and ovarian arteries. Okay, as I guess you have got a picture clear. These are the most important points when it comes to the anatomy. So you can see the picture there. You can see the uterus, the parts, the cervix, and the body, etc. Next comes to the physiology of uterus. So what are the functions in the uterus? So as I have mentioned about the layer endometrium. So the endometrium layer goes through the like undergoes the cyclic changes during the menstrual cycle, and there are two phases: proliferative and secretory phase. And the proliferative phase is the like where you can see the estrogen hormone, and secretory phase where you can see the progesterone. So these changes, like when the physiological changes in the what's happening in the uterus, prepare the uterus for pregnancy. So clinically, like hormonal imbalances affect these phases, leading to infertility. So when there is a variation in the hormones like estrogen and progesterone, and these things affects and may lead to the infertility case, as well as the abnormal bleeding or endometrial hypoplasia. And if menstruation occurs if no implantation happens. So when there is no implantation happening in the uterus, then the female will menstruate in that month. So this is what the basic physiology of what is uterus. And talking about the fallopian tube, that's the like as you can see the tube there. It is like what to tell. Two side in the uterus you can see two sides, like a tube like part that is called the fallopian tube. And fallopian tube, these the tubes are the meeting point of sperm and ovum. And if there is any blockage of the tube, it is one of the most common causes of infertility. And also the ectopic pregnancies often occurs in this fallopian tube. So these are the things which happens in the fallopian tube. One is like in tube you can see the from the ovum from the ovary, and the sperm will meet in the fallopian tube. And if there is any blockage in the tube, the meeting of both the ovum and sperm will not happen. And then it may be if there is any blockage there, the ovum will not pass through the fallopian tube to meet with the sperm, so there will not be a possible of uh, like fertility, so it can lead to infertility. And in few pregnancy cases you can see ectopic pregnancies in the fallopian tube. So this is what the clinically what happens in the fallopian tubes. And about talking about the parts, there are four parts: infundibulum, ampulla, isthmus, and interstitial. And as I have mentioned, the site of fertilization happens in the ampulla, and where this fallopian tube transport the ovum to the uterus, and the cilia and muscular contractions aid the movement. So the movement, when the ovum is transported to uterus, the movement and contraction, like the movement will happens due to the cilia and muscular contractions in the fallopian tube. So this is what the fallopian tube means. Moving on to the ovaries. So ovary anatomy, like anatomically it is very important because ovarian tumors and cysts are common clinical problems in this. And ovaries is also a frequent site of torsion, pelvic pain. So this is what the anatomy. And as it is like you can see in the pictures in the previous slides, you might have seen that it is a two part, so it is paired almond shaped organs. Like you can see the fallopian tube carries that ovary, so it is in the both the sides of the uterus. So there it is a paired structure, and it is an almond shaped organ. It is located in the ovarian fossa on lateral pelvic wall, and the surface is covered by a germinal epithelium layer, and it is attached by an ovarian ligament. As you can see in the previous slides, you might have noticed there will be a ligament which is attached, that is the ovarian ligament. So this is the basic anatomy of what is ovaries. Moving on to the physiology part, ovaries. So the ovarian function is tightly linked with the menstrual cycle. So oogenesis that happens in the ovaries, that is the formation of ova. So in the ovaries, the ova will form ovum, or ova will form. That formation is known as oogenesis. And hormone production. So as I have mentioned, there is a two phase, proliferative and secretory phase. The proliferative estrogen and secretory phase is progesterone. So these estrogen and progesterone hormone production happens in the ovaries, and the regulation of FSH and LH, so follicular stimulating hormone and LH from the pituitary gland, and the corpus luteum forms after ovulations. So this is the physiology of ovaries. And most of the times the disorders like PCOS cause the anovulation and infertility. So in conditions like PCOS, polycystic ovarian syndrome, there will be anovulation, means ovulation doesn't happen, and it can lead to infertility. So this is what happens in the ovary. So if there is any deformities in the ovaries like PCOS, PCOD, etc., so in these such cases, the formation of ova or the ovum production will not happen. So that can lead to the infertility. So because once the ovum is ovum is released, and it is ova egg is released and it is meeting with the sperm, then only we can lead to the fertility there. But if there is no ovulation happening, there will not be production of ova, and the egg will not be released, and the egg will not meet with the sperm, and so there can lead to infertility. So in cases of PCOS and PCOD conditions, when the ovaries are not functioning properly, there will be no formation of ova, and there will be no release of egg. So this is the basic form physiology of ovaries. Next is the physiology of menstrual cycle. So the menstrual cycle is the important part of this female reproduction. So this axis explains the most menstrual disorders. So the menstrual, if there is any disruption at any level, like hypothalamus or pituitary or ovary, it can lead to the amenorrhea or irregular cycles. Like hypothalamus, it will generate GnRH, and it will lead to pituitary, and the follicular stimulating hormone stimulates the follicular growth and estrogen secretion, and LH surge the ovulation. So progesterone from the corpus luteum supports the endometrium, and the cycle repeats if no fertilization happens. So as I've mentioned, if the ovum is not meeting with sperm, and the like if the menstruation happens, if there is no meeting of this two, so the egg get released, and if the fertilization does not happen, then the patient or the female will menstruate in that month. So the cycle repeats. So if the fertilization is not happening, the cycle repeats. The menstruation will happen for the female, and in case if fertilization happened, then the cycle stops. So this is what the what happens in the menstrual cycle. Moving on to the clinical correlation. So clinical correlations are like like what are the things which we can relate to the patient in clinical basis. So for example, amenorrhea. Amenorrhea means the condition where there is no menstruation or absence of menstruation. Menorrhagia. Menorrhagia is heavy menstrual bleeding. Dysmenorrhea. Dysmenorrhea is painful periods. And infertility is often due to the tubal, ovarian, uterine dysfunctions. These things are the most common OPD presentations in gynecology. So each can be traced back to structural or functional problems in genital anatomy or physiology. So if there is any anatomical deformity in the female reproductive organ or tract, or if there is any physiological deformity in the female genital tract or organs, these things can lead to these conditions like amenorrhea, menorrhagia, dysmenorrhea, and infertility. So if there is any structural deformity or physiological anatomical functional problems, that can lead to these such conditions. So this is the most common OPD presentations, which or clinical OPD cases, which we can do the correlation with the clinic. So moving on to the investigations. So first, the basic workup, which includes in the investigations of female genital tract, is pelvic examination and ultrasound pelvis. And the hormonal profiles and the HSG are the most important in infertility evaluation. And MRI or CT will help in the complex pelvic masses. So these are the most important uh, investigations when it comes to the female genital, when we need to examine the female genital tract or organs. Pelvic examination is a must, ultrasound pelvis is a must, and hormonal examination, hormonal profile should be investigated, and HSG, hysterosalpingography, and MRI and CT if indicated. So it helps in the, if there is any complex pelvic masses, it will be helpful. So these are the basic important investigations in the female genital tract and organ. Moving on to the management. So in OPD cases, how we can manage? So in OPD, most cases are like mild cases, like for example irregular menstrual cycle, and PCOS, mild infertility. So these things will come in the OPD basis. So menstrual irregularities, we can evaluate with the USG and hormones. So you can go for hormonal profiles, etc. And you can treat the condition with hormonal therapy or iron supplements if anemic. And infertility cases, basic evaluation counseling should be done in the OPD basis. And symptomatic treatment, if the patient is complaining of dysmenorrhea, menorrhagia, so you can give a symptomatic treatment for these such conditions. And all the clinical conditions are mild, so we can be managed it can be managed with medications, lifestyle advice, and supplementations for necessary deficiencies. So this is the way you can manage the conditions, like for the OPD basis. And moving on to the IPD basis, how you can treat the patient in the IPD basis. So IPD managements are mostly we do for an acute or surgical cases, such as uncontrolled bleeding, or fibroids, or large ovarian cyst, or infertility. So in such cases we can go for a surgery. So if there is any severe abnormal uterine bleeding requiring transfusion, in such condition you can go for IPD management. Surgical management, like myomectomy, hysterectomy, for these things you can go for IPD. And tubal surgery for infertility, and ovarian cystectomy or oophorectomy if indicated. So in such surgical procedures, surgical management, you can go for an IPD management. Mostly mild cases will come in the OPD basis, that you can advise medications and lifestyle and clear it up. And while coming to the surgical and acute cases, you can go for the IPD management. So to summarize the topic female genital organ, so as I have mentioned, the female genital tract anatomy, it includes vulva, vagina, uterus, tubes, and ovaries. So these things comes under the female genital tract anatomy. And the physiology involves the menstrual cycle, ovulation, hormone regulation. So in the anatomy part, you can see the vulva, vagina, uterus, tubes, and ovaries. So there is the anatomy part. In physiology means what happens in the uterus of female genital tract: menstrual cycle, ovulation, hormone regulation. So these three are the important physiology which are happening in the female genital tract. And clinical relevance. So and basically understanding the female genital anatomy and physiology is very essential for both diagnosis and management. So once you know the anatomy exactly, and whatever happens with physiology of especially the physiology of menstrual cycle, the ovulation, and the hormone things, so these are the most important point when it comes in the diagnosing the and management, as well as in OPD and IPD cases. And clinical relevance, like menstrual disorders, infertility, gynecological conditions are the things you can see. And the management to disorders can be picked up in OPD, but severe cases which requires hospitalization surgery should be done in the IPD basis only. So this is the summary of today's topic, female genital tract. I hope you got a clear picture of uh, about the anatomy and physiology of the genital tract. I have mentioned only the most important points and most important things for you to keep in mind. So this is the end of our topic for today. I hope you got a clear picture today. Thank you.